Hi, I'm Dr. Lexi Frydenberg, General Paediatrician. I work both in private practice and have been working at a major Victorian paediatric hospital for over 20 years. I see children from age 0 to 18 with a broad range of medical and developmental issues. I'm now going to talk about some common conditions that present to paediatricians when an infant is 3 months to 12 months of age. The first one of these is fever. It may seem that your child always has a fever because fever is just so common. In children, we call a temperature more than 38 degrees a fever, but most children are pretty well with their fever and we don't need to treat them. So most fevers are due to viral infections, and viral infections do not need treatment with antibiotics. Only bacterial infections do. As doctors, we're more worried about what's causing the fever and treating that if needed, rather than the fever itself. So we look for things like ear infection, a gastrointestinal illness, a cough or cold, to really try and work out what we need to treat. We don't need to treat fever itself if the child is happy and well. But if your child's unwell, miserable or uncomfortable, you may decide to use paracetamol or ibuprofen to try and make them more comfortable. Fever is your body's way of fighting infection. It helps the immune system, so fever is not a bad thing. If your child is less than 3 months of age and has a fever, you do need to get them checked because they can't tell us why they're sick. If your child is unwell, they're getting worse, they have a temperature greater than 40 degrees, or the temperature persists, we do recommend you get your child checked at the doctor or emergency department. Viruses are the most common illness we see in children. There are hundreds of viruses out there. Most children in this age group get recurrent viral infections due to a lowered immune system at this age, which is quite normal. They're also exposed to lots of bugs through childcare and often through older siblings. But in the vast majority of children, we don't need to test the immune function of children with recurrent viral infections. Most viral infections are mild and don't need any treatment except rest at home. But if you're worried about your child or they're really unwell or their symptoms persist, you should go and see your doctor and get checked. Eczema is a really common skin condition that we see in infants. We might also see it in newborns and older children and adults as well. Eczema is a skin condition, but it's not contagious. It usually appears as a red, itchy rash on a child's skin. In babies, this might be on the face or on the scalp or body, but in older kids, it tends to be in the creases of the elbows, behind the knees, on the wrists or on the ankles. We don't have any cure for eczema, but there are many things you can do to try and help control your child's eczema. It's important for them to avoid anything that irritates their skin, to moisturise regularly, to stop them being overheated, so to keep them cool, to try and control any itching they may have. And you might want to try some topical treatments such as a topical steroid cream that you can buy over the counter on the patches of eczema when they flare up. But if your child's eczema is not well controlled, you should see your GP because they may need to prescribe a special eczema cream and write an eczema treatment plan. Many parents ask whether the eczema is food related. In most children, eczema does not appear to be food related. The exceptions with that, if you have a young baby who has significant eczema and it's widespread, it may be related to food. And in the older children, if the child's eczema flares up every time they eat a certain food, there can be a relationship between them. But in most children, we don't recommend eliminating foods from the diet. We recommend controlling your child's eczema so they're comfortable.